listeners to NBC Television and Real FM. I am Jade Brown, and this is another installment of Public Health Insider PHI. Of course, on PHI, we focus on universal health coverage and the St. Jude Hospital reconstruction project. But for today, we will be taking a little turn and discussing something very important. In fact, two items that are very, very important to the Ministry of Health, Wellness and Elderly Affairs, and of course the nation at large. So at this point, I would like to welcome my guest for today. This is Dr. Gomez. Dr. Gomez, how are you? Can you introduce yourself to our viewing and listening public?
Thank you, Ms. Brown. Good morning to everybody. My name is Dana Gomez. I am a physician. I work with the Ministry of Health. I am the surveillance officer at the epidemiology unit of the Ministry of Health.
Okay. So today we'll be discussing, the first half of our show, we'll be discussing hand, foot and mouth disease. Tell us a bit about hand, foot and mouth disease. What exactly is it?
Okay. So the hand, foot and mouth disease is basically a viral illness. It's a viral disease. Mm-hmm. It is caused by a number of viruses. One of those are the enteroviruses and the Coxsackie virus. Now, the enteroviruses can be found in respiratory droplets, as in the nose, as well as in the digestive tract, which we find in the stool, the saliva.
Okay.
So it's quite common disease, and we normally get increased cases around September, August, particularly in the preschools and the daycares. So this is one of the reasons why we are on the show today, and thank you for having us on your show today.
Okay.
So that we are able to inform the public of what is going on and how they can prevent the spread of the disease.
I know you mentioned, but can you elaborate the signs of hand, foot and mouth? So how would somebody know, hey, these are the telltale signs of hand, foot and mouth disease?
So hand, foot and mouth disease normally occurs in children less than 5 years of age. And the reason it occurs in this age group is because the children are immunosuppressed, or meaning that the immune system is depressed. And also because at that age in the preschools, the children are sharing cups, they're sharing break. Can I have some of your break? So it basically spreads very easily in the daycares because of the mode of transmission. Some of the signs and symptoms, usually the child, you would see that your child is a bit unwell. They would have fever, their appetite would be poor, and then you would start seeing the spots within the mouth. That is why it is called hand, foot and mouth, because it affects the hands, the mouth and the feet. You would see the red spots on the hands and also the spots on the feet of that individual. Okay. The child you might notice that your child is drooling. That is because there are sores in the mouth of the child.
Okay, is it extremely painful?
Yes, if you have sores that are in your mouth, of course, yes, it will be painful. And we do advise that when the children do have the sores in their mouth, that you don't give them anything that is acidic or anything that's spicy that will increase the discomfort to that child.
Okay, and you did mention how it's spread in preschools, but in other ways for adults, maybe, how else can it be spread?
It may affect adults, but usually it's children it affects because of the immune system, and also, as I mentioned, because of the mode of transmission at that particular age, because children have at that time they're developing their tactile, and they love to touch. That is how they explore the world. So adults may get it, but it is very rare. It's mostly children under the age of 5 years.
Okay. So as a parent, how would one protect their children against this disease?
So, that's one of the reasons why we're speaking of it today, because normally it starts around this time in August, September. It is associated to periods of heavy rainfall. It has been known. Last year we had the same issues. So it is something that is consistent in our in country. So we always have a number of cases appearing in the daycares. So we are speaking to the administrators of these preschools as well as the parents, so that they know the signs, which I just mentioned, the poor appetite, the fever. Granted, we do have dengue occurring at this point, so we do have that little outbreak of dengue occurring, as well as hand, foot and mouth. So both of them do appear with fever, but the signs with hand, foot and mouth are definitely different, in terms that you would notice that the child does have the spots in the mouth, the hands and the feet. In terms of prevention, if you do notice that your child has fever and these symptoms, it is preferable that you keep your child at home. The symptoms, the disease lasts for about 7 to 10 days. Most of the times it's self-limiting, meaning that it goes away on its own. At times you may need to see a physician, but it's the treatment for this disease is basically the use of paracetamol, Calpol, also called cetamol, use of paracetamol. So it's symptomatic treatment. So as you have the symptoms, you give treatment for the symptoms. So paracetamol for the fever and the pain. Sometimes the physician may prescribe a topical anesthetic for the ulcers within the mouth, because the child would not want to eat, the appetite is poor, and also a little bit of antihistamine to help with the pain. In some instances you may have complications, because it can lead to dehydration if the child is not eating. Children can dehydrate quickly because of their mere size. So in those instances they need to be admitted. You would give them rehydration fluids and IV tubes. But for the most part, the disease can be treated at home, and most cases are not admitted and they're treated at home. Now the disease lasts for about 7 to 10 days. So until the lesions have not healed, which is the spots that the child have not gone away, it is advised that parents do not bring their children back to school. So they remain at home until the child is better.
Okay. And I don't think I caught that part. The lesions, would it be infectious or?
Yes, the lesions are infectious. So it's the saliva, the nasal secretions when the child coughs and sneezes, the saliva of that child, because when the children are sharing cups and utensils, that's one way that it spreads, as well as the blisters. So that is one of the reasons for keeping the child at home as well. Okay.
Sorry, you were adding?
Oh yes, so I was just saying, so it is important also to ensure that the whatever the child uses is properly cleaned, in terms of their toys, cups, whatever they use, with a bleach solution, which I think we will get into a bit later.
Yes. On October 1st, which was yesterday, the Ministry of Health issued the statement about hand, foot and mouth disease, putting preschools, health educators on guard about it. What has the response been, or what is the response like on a yearly basis from the preschools? Do you find that they are adhering to the warnings and the cautions that you would issue, and what are some of the ways in which they can improve that?
So one of the things that we do notice, last year we did have a meeting with the Ministry of Education and the administrators of the childhood care. This is something that we are also planning to do this year. In terms of adhering, the persons who work at the childhood centers or the daycare centers, they are able to recognize the signs and symptoms, and from what I know, they do tell the parents to keep the children at home. So they are very good at recognizing the signs and symptoms. But as usual, you always need to give a refresher and to always make persons aware of what is happening. Pretty similar to dengue. We know that dengue is endemic in St. Lucia, but you always have to give the public a reminder to tell them what are the signs and symptoms, what is the treatment, what are the prevention methods. So this is one of the things that the Ministry of Health engages in doing.
Now, in speaking of prevention methods, how would a preschool, having witnessed or having noticed that a child is infected, they've done the due diligence and sent the child home with their parent for treatment at home, how would they then go ahead and protect the other students in their preschool, in their care?
So first off, it starts with recognizing the signs and symptoms, isolating that child. It is important to have an area where you can isolate anybody who's infectious. Pretty similar to what happened during COVID-19. It's always good to have a sick room or a sick bay where you can isolate that child and inform the parent that the child has the symptoms. Having done that, it is important to do the cleaning and disinfection. The cleaning and disinfection can be done with bleach solution or any other solution that is recommended by the Environmental Protection Agency. Yeah, so the bleach solution would be one tablespoon of bleach to 4 parts of water to clean the toys, the hard surfaces such as the doorknobs, the toilets, wherever that child may roam, because it is a disease that is very contagious. So you would have to do that cleaning, ensure that you clean the toys and whatever the children use with soap and water first as well, and allow that to air out. So if in the event that there is a child or you notice that several children are having that issue, it is important to do that cleaning and disinfection within your institution, and also to alert parents as well. I think that the administrators of these institutions should have a plan or probably a leaflet, or I know a lot of them have WhatsApp groups where they can send information to the parents, letting them know that this is a season that you may have hand, foot and mouth disease, and what are the prevention methods and what can be done to prevent your child from acquiring the disease.
Okay, so where can people go to get more information on this?
So there is the Bureau of Health Education that has media cards. They have prepared media cards. They have disseminated that information to the administrators of the different schools. I know a lot of the schools have WhatsApp groups because this is the easiest mode of communication, and they've disseminated that through the WhatsApp groups. But the Bureau of Health Education, we also have the health educators who go to the schools, and seeing that we have a number of schools reporting an increase in cases or seeing the cases. We have our outbreak investigation teams, and each team has a Bureau of Health educator that will go out to the school to inform the schools, whichever schools are affected, as well as schools in general, to inform them of the disease and prevention methods.
Okay. Now, speaking of health educators, we do have a health educator on with us today, Miss Shalane Edward. She will be speaking about breast cancer. We will be taking a break in just a moment, but before we do so, I would like to ask Dr. Gomez, is there anything else you'd like to add in terms of the education efforts, spreading that knowledge about hand, foot and mouth, or any cautionary messages you would like to issue to the public?
Yes, as I mentioned before, this is the season when we see a number of cases of hand, foot and mouth disease. We've spoken about knowing the signs and symptoms, what are the possible treatments. If your child is not getting better, of course, the wellness centers are there, so you can go to a nearest wellness center to seek medical attention. And also we have the resources within the Ministry of Health, persons who can give you enough information on the disease, and you can also call the Bureau of Health Education and the Epidemiology Unit at 468-5324 or 468-5325 to get further information on the disease.
Thank you so much. Thank you. So you just heard there from Dr. Gomez, who spoke on hand, foot and mouth disease. As she indicated, we are seeing an increase in the number of cases, particularly in children of a preschool age. The information is out there. If you have missed any part of this show, if you're just tuning in, you can of course go to the Ministry of Health Facebook page. I believe they do have an Instagram page as well for more information, or you can re-watch this broadcast to get all the information you need on this disease. Like she said, it's just about protecting and keeping your environment clean as well, and knowing the signs, knowing how to identify it, and then issuing that care to your young one. So thank you so much for joining us today. We'll take a quick break and then we will be joined by Michelle and Edward, who would be speaking on Breast Cancer Awareness Month. There's so many activities by the Ministry of Health, Wellness and Elderly Affairs, and we're about to hear of them all.
The Ministry of Health has launched yet another service under universal health coverage. This new service includes conducting pap smears using liquid-based cytology, which will assist in eliminating cervical cancer.
This new method of conducting pap smears is more comfortable and more convenient. So ladies, contact your nearest wellness center to get to know about our pap smear clinics.
Turnaround time for HPV testing is 1 week. Any abnormal or positive test, there'll be a following week for the cytology testing. We're also going to test for HPV strains 16 and 18, which are the most aggressive, which cause cervical cancer. We can also test for other STIs, such as herpes simplex type 1 and type 2, gonorrhea, chlamydia, and others.
Patients with an abnormal HPV and an abnormal cytology shall be referred to the colposcopy clinic. At that clinic, we shall assure that you get the proper treatment and guidance.
So come in and access this new service. Your health is our priority.
Welcome back to Public Health Insider, PHI, here on Real FM. I have with me Miss Sherlan Edward, who is a health educator attached to the Bureau of Health Education in the Ministry of Health, Wellness and Elderly Affairs. I did say that she will be speaking on Breast Cancer Awareness Month, and we will be doing that. But first, Sherlan is going to speak to us, Miss Edward is going to speak to us a bit about how they go about educating people going into the various communities. How do you do that, and what is the plan that you are executing currently in terms of hand, foot and mouth disease?
Thank you, Ms. Brown. As to add to what Dr. Gomez said, as health educators in the Health and Education Department of the Ministry of Health, most of us are assigned to a region, and we have a relationship with our region. So any health issue or health emergency or whatever issue observances that we have for the month, we go in and we try to engage the children, the parents, and also the teachers. So on the children's level, we usually go in and do programs with them, especially as we have hand, foot and mouth. We teach about hand hygiene, and we have a month for hand hygiene, but we go in and we talk about how to wash your hand, the timing to wash your hand. We talk about germs and what does germs do, so at least the children are aware. And we realize a lot of children know how to wash their hands, but it's just that sometimes they're little people, they forget. And we talk to the teachers about also reinforcing it and sanitizing the areas, especially where the high traffic, where the children use. And we try to capitalize a lot on PTA meetings where we meet the parents. And so we really want them to come out. Some persons don't come out, but we get persons who come out, so that at least they are aware of what is happening, so that they too can be on board with hand hygiene. We in St. Lucia look at hand hygiene as a simple thing, overrated. But most of the infections and the spread of different diseases and viruses are based on our hand. What we touch, what we do with our hand, we get a lot of persons not understanding that if you just practice simple hand hygiene, these things can be rectified.
Okay, fantastic. Okay, so how has it been going thus far? What's the level of response that you've received from the public?
We are getting persons who are doing it, because sometimes when we go in to do reinforcement with the education, persons know what to do. So there are persons that are aware, persons practice. We still get persons that are not receptive to it because they think it's just simple. Why are you telling me that I'm supposed to know that? But at the moment, they do not practice it. So we still go and we educate whatever instance we can, whatever opportunity we get, we do educate, because we realize that they need to be reinforced, that information needs to be reinforced to the public. So sometimes we give out hand sanitizers, persons who using more hand sanitizers during COVID, and now we don't have much of that, but we still enforce that in the absence of water, you can still use hand sanitizer to practice hand hygiene.
Okay, excellent. Thank you so much. Is there anything else you'd like to add in this regard?
We're just asking persons to please remember some of the things that what is happening, like Dr. Gomez said, that outbreak. We have so many cases of hand, foot and mouth and dengue and everything else. Is just to make sure that they take the information, use that information to their advantage, so at least they can prevent this spread and prevent persons from getting sick and being hospitalized with some of these conditions that can be treated at home.
Okay, excellent. Thank you so much. So let's move on to Breast Cancer Awareness Month. We all know that the month of October is all about breast cancer awareness, spreading that information that women and men need to just be aware of what breast cancer is, the signs, how to identify it, and then what to do once you've gotten a diagnosis, or somebody in your family or loved one has gotten a diagnosis. So tell us a bit about the education effort by the Ministry of Health for this month.
Thank you for adding in the men, because sometimes we forget that men do get breast cancer. That's why I came in my pink to represent. So we are trying our best, and we have over the years tried to push a lot of screening for early detection. So we have many activities at our wellness centers, and we are extending it most times, well, all the time, to the workplaces. We have workplace wellness that we go into the education. So we have the nurses and the health educators at the facility doing on-site education sessions. We are asking corporates and we are asking workplaces to just deck the workplaces in pink, so that we get some visibility for the activity or the observance. We have a lot of media cards, because we know persons, that's the platform they use, social media. So we have developed many social media cards over the years that we disseminate to persons we know. We disseminate to our other facilities, we disseminate to the schools and everybody that is on our WhatsApp platform, and even Facebook and other platforms we use to get that information out. So we do a lot of education in terms of explaining what is breast cancer. We do educations at the workplaces, because they request that we come in to do sessions just to educate the staff as to what is happening. Okay, great.
So tell us a bit about the activities. Is there something going on today? Am I correct?
At the Ministry of Health, or?
I believe Onika said that there's something at the playing field in Leclerc. Is that a different campaign?
Oh yes, it's a different campaign with the elderly person.
Okay, but we can talk about that as well, because it's going on right now. Am I correct?
I think so. Yes, it is. I think it's education. It's exercise session with the elderly.
Okay.
My colleague is the one leading it. I don't have much information, but I know I just saw a video that persons are engaged in physical activity.
Okay.
So it's a physical activity component we're trying to get the elderly persons to engage in physical activity more. Doesn't matter the age, there are physical activities that you can engage in. So that's what's happening now.
Okay, excellent. So you can, of course, go on down to the Leclerc playing field and engage in that activity. Now, heading back to Breast Cancer Awareness Month, like you indicated, the Ministry of Health has many activities planned throughout the month to spread the awareness. So for somebody who let's talk about men for a moment. If a man wants to get that mammogram done, how can he go about it? Because I do know under UHC, if you go in for your pap smears, of course they would perform a mammogram for you, but that's the women that go in for the pap smears.
Yes.
Does the same apply to men? Can they walk in and just ask a healthcare provider for the assistance in that regard?
Yes, they can. Yes, they can walk in and ask to do the screening. So it's the breast examinations. We don't get many men generally at the facility, but we get persons when you tell them, okay, men get breast cancer, and they see the comical side of it. Okay, so you're going to be filling me up, so okay, I'm good with that. But yes, the men can walk in. Also, the ladies, when you come in to do your pap smears, the nurse does a self-examination for you. We actually teach persons how to do that examinations because we don't want to wait when your pap smear is due to do an examination. So whatever in between that can be captured before that pap smear duration, maybe 2 to 3 years, we want you to do it monthly after your period, like 7 days after your period, after all these, the tenderness and the burning, whatever is happening in your breast has gone, to do your own examination. So we teach people how to do the self-examination so that in the event that you capture something, it can be treated early. So that is happening every time when you go to the facility. You get the pap smear and the self-examination, and we have sessions. We teach persons how to do it.
Oh, okay. So if an individual cannot make it to the session, how would they learn about doing a self-examination?
That's why we're asking the corporate St. Lucia to come in and do these sessions. When we do health fairs, most times we do health fairs with the workplaces. We try to do a holistic approach. We come with chronic disease, but we try to talk about cancers because it's so prevalent, and we teach persons what to do at the workplace, because we know that sometimes persons cannot come out to the facility, so we go to them. So we even suggest that, okay, you have your population is more women, we can suggest that we do things like that, so at least the woman knows that she can do an examination by herself at her home, in her privacy of her home, and if anything is detected, she knows that she can come to the facility and we can do further investigations.
Okay, so the support is there for the women.
It is there for the women especially, and we want to extend that support to the men, because most persons are not aware that men get breast cancer also. I mean, it's not very common nationally, globally, but men, we have a few numbers of men in St. Lucia who have been diagnosed with breast cancer.
And speaking of the prevalence of it, we do know that it's way up there in terms of one of the main killers in St. Lucia. That would be breast cancer. How concerning or alarming are the figures? As a health educator, what can you say about that?
The numbers are, when I saw the numbers during our campaign, I felt that it was a lot, especially with the type of breast cancer we have, which is invasive ductal carcinoma. Most persons are diagnosed with this one. But the flip side of it, which is a little reassuring, is that we see the numbers of survivors are increasing. Doesn't matter if it's just slightly, but we are seeing persons who are accessing management and treatment, and because of all our efforts to educate and go and do the screenings, we capture these things early so that these persons can get the treatment they need. So we know that the numbers are a lot. It's the number one killer of women, breast cancer, but there are measures in place, and we are trying our best to upscale our early detection, which is the screenings, and have persons referred so that they can get the treatment that they need.
Okay, now it is 10 o'clock. We are coming to an end, but my last question or comment to you would be about young people. We know that breast cancer doesn't discriminate. It can affect anybody from any walk of life, but we do find that a lot of young people believe, oh, it can't happen to me, and this is something for middle-aged women or older women. What message would you have for them?
I'm so happy that you said that, because our sub-theme this year is Big or Small, Check Those Lemons, which flows in with last year's theme. So one of the activities the Ministry of Health is undertaking is going into the schools. So we are starting doing the breast examinations from Form 2. When they're not in that stage, they're giggly and whatever. And we have captured little breasts, little lumps, and we have referred persons. So we are engaging the schools, especially the secondary schools, to go in and do the examinations with the students at the school, at the facility this month. So that's one of the things we are doing. And wherever we can get the students or the younger persons, we are telling them, not because your breast is small that you cannot get breast cancer. It doesn't matter the size. Once you have breast tissue, you can get a lump and be diagnosed with breast cancer. So we are trying to reach the younger persons this year by going into the schools and do activities at the schools, education, and also screenings.
Okay, well, like I said, cancer does affect anybody from any walk of life, but what about the importance of a healthy lifestyle and how that can impact your health?
It is. We realize that most cancers have some relation to your eating patterns. So we still do our education on healthy eating, healthier lifestyles with cutting down on processed foods, watching what you eat, the times you eat, managing it if you exercise also. I mean, it's not every day you can do it, but at least trying to make changes, simple changes, small changes, which big rewards in the end. So we're asking persons, even when we do our education, we add the nutritional component of it so that persons understand there is a link so that they can change the eating patterns.
Okay, thank you so much. I think we've learned a lot today about breast cancer, about hand, foot and mouth disease. It's been a pleasure having you on the show.
Thank you so much. It's been a pleasure also.
Okay, thank you viewers for tuning in. Next week we will be discussing the St. Jude Hospital reconstruction project. A couple weeks ago you saw that the government of St. Lucia and the Saudi Fund for Development signed a $74 million contract. It's 2 contracts in fact. We have some key facts coming out about that later this week from our office at the Ministry of Health, Wellness and Elderly Affairs. So please stay tuned and look out for those updates on our Facebook page. But next week we will be discussing the St. Jude Hospital reconstruction project, which is well on the way to completion. That is of course according to contractors Renault, Gajada and CIE. So we will see you next week right here on NBC Television and Real FM, as well as the Facebook platforms from 9:30 to 10 a.m.
Get geared up to Open Creole Month with the most anticipated Oktoberfest en Guayal Creole Brunch. For the first time ever, be welcomed by a delicious complimentary Creole breakfast